and welcome to the MIMIT Health Live Life Fibroids Free Health Talk. I'm Sandra Robinson Cunningham, and I'll be your host for this evening. And today we have a powerful 1 hour packed with information, Q&A, details, as well as testimonials. There'll be an up close and personal chat with some of the doctors and leading professionals in the women's health segment. And we also have an opportunity for you to participate because I'll be asking you questions as well. So, ladies, I want to just share with you another thing as well. You'll be pleased to know that MIMIT Health is here to serve you in every way possible. Please take a listen.
Welcome to MIMIT Health. We're one of the fastest growing physician groups and health system in the country, and we are here to serve you. We specialize in minimally invasive procedures, whether it's spine, arteries, veins, prostate, fibroids. We do a wide variety of things, but we're here to solve your problem for you. We have some of the most highly talented, qualified, humble people who are here to serve you. We believe in servant leadership and to care for.
We are ready and available to serve you now. Call 708-486-2600. Telehealth services are also available.
All right. See, MIMIT Health really puts the health care and the care back into healthcare. So we're going to get started today as well. And I want to make sure that everybody is comfortable and everybody is okay. So before we get started, I want to just ask my first questions. Ladies, if you would just enter your age and poll in the polling section on your screen, that would be very helpful. Very good. While we're doing that, we want to just make sure that everybody understands. If you just can tell us what your age, that would be great. I see you guys are doing it now. To get started, we are going to hear from someone who may have been just like you. She's our patient advocate. Her name is Tommy, and she's had so many issues and problems, and she talks about them. But most importantly, she talks about how she got help and how she's living fibroid free. Take a listen.
My name is Tommy. I'm a registered nurse. I work in the hospital. I've had an experience of fibroids for a couple of years. So during the course of the fibroids, when I was having it, I will be having like a shortness of breath because my stomach is like up into my epigastric area, and each time when I eat, I'll be having nausea. Sometimes I even vomit. So it's kind of very frustrating thing for me. So when I discussed with one of my friends, he introduced me to Dr. Chopra. So the date was set for UFE. Afterwards, after 2 to 3 months, I started having a little bit relief. Like I'm not going to the bathroom anymore. Not frequently like as it used to be. It's reduced from the preparation room to where the procedure. The whole thing did not take more than 3 to 4 hours, and I was discharged home. No nausea, no vomiting, no bloating, nothing like that anymore. I'm free. So I would recommend it because it's not invasive, that somebody will be caught, that you will be nursing a wound for months, and at the same time, I've seen people going through those procedures like having a surgery that do not make it. I think this is a very good procedure for women that are having fibroids.
And ladies, I see that a lot of you are in that 40 to 50 age group. And so I am sure that many of you can really relate to Tommy and some of the experiences that she shared and some of the symptoms that she had. Now I would like to introduce to you Dr. Angela Walker. She's an OBGYN who is joining us today to talk about the important issue and how this issue has affected African American women. Dr. Walker?
Hey,
there you go. Yay!
Hello, everyone. Funny enough, with your poll, I am too in my 40s and almost 50.
Okay.
So this is incredibly important to my age group and my patients. For your listeners out there, thank you for this opportunity.
Mhm.
My name is Angela Walker. I am a mother of two wonderful boys. I'm an active dater. I'm a best friend, and I happen to be a board certified obstetrician gynecologist practicing over 15 years. I've had the pleasure of training many residents, medical students, NPs, PAs, and nursing students who have gone on to do incredible things, and I'm very proud of them. If anyone's listening, shout out to them. I've also had an opportunity to be mentored by several amazing people, just, to name a few: Cheryl Gibson, who's the Michigan Medical Society president and was recognized by our lovely new vice president, Ms. Harris, Vice President Harris. Mary Palmore, who is a obstetrician gynecologist practicing here in the Chicago area and has chaired many OB units in different hospitals. Um, Parents. My dad was an Anglican bishop, and my mom was, well, it still is, the best second grade teacher on earth. Where my dad was a bishop, my mom smoked Newports in the back of the church. So I
Oh boy.
had an opportunity to experience both, dignitaries and Ruby on the corner. And what I find is that we all kind of have the same dilemmas when we consider fibroids. And, when I turned 40, maybe 10 years ago, maybe, or 9 to 10 years ago, the only treatment option that we had was it's time for your hysterectomy. And, just looking at the ramifications of the scar tissue, the pseudomenopause, for our younger patients that also have fibroids, we'd offer them myomectomies for fertility. And once we did it, we could only offer them C-sections. So I was excited to learn of different options, just beyond the traditional two that most people are, familiar with. And so nowadays, I can offer, naturally the Dapolupron. And if you're over 50, you've probably been introduced to that to shrink your fibroids, but you can only use it for a short period of time. A lot of times it's only 6 to 9 months. There's osteopenia associated with it. And so, while it is an excellent drug, there are some side effects. So when I was introduced or started to consider outside the box options, uterine artery ablation or uterine fibroembolization became a viable option for most of my patients. I liked it because, I see my patients in Walmart or Neiman Marcus, depending on what my money looks like. And once they have experienced it, they give me all this praise like, oh, I feel wonderful. It was really quick. The recovery was great. And so I love to introduce my patients to this procedure. And if you think about it, right now, it is one of the better procedures in light of the nosocomial infections that are out there. And when I say that, I mean, we used to be worried about MRSA and C. diff, but now COVID has kind of changed the way that we practice. And so this procedure where people will usually look to do the myomectomies or the hysterectomies, which required you to stay in the hospital for long periods of time and be exposed to those different infections, provides an outpatient procedure. A lot of these procedures can be done in a surgical center or a really quick hospital visit, which usually is outpatient, which decreases your exposure. So it's idea in this new normal that we're dealing with. Again, I see great results from my patients. The team at MIMIT are really good to take care of, from Medicaid to, PPO or HMOs. They make themselves accessible to all, walks of life. And so I have really nothing but good things to say in this regard. And, I'm so happy that I have this option for my patients. Okay, that was a lot.
No, that was perfect. That's exactly what we needed to hear. And we thank you so much for your insight. Dr. Walker, are you going to be sticking around for a little bit?
I'm going to try. I have two patients that I was just on the phone with who are feeling pushy. And
Okay.
so I have to kind of keep my ear to the ground. As you see, I'm still at work.
I do
No lunch,
see, but
no
not a
nothing.
problem at all. We thank you so much for your insight and we appreciate you for coming on with us, okay?
Thank you, and please just make me accessible to your audience. I'm happy to answer any questions, give my expertise, help them with referrals, whatever they need. I'm happy to be of service.
We appreciate you so very much. Thanks again.
All right, take care.
All right, bye-bye now.
Bye bye.
And speaking of questions, ladies, don't forget we will have a Q&A section at the end. So if you have questions, you can always put them in, even right now, into the questions section, and we'll be able to answer those questions. I'll submit them to the doctor, and you'll be able to get your questions answered. And speaking of the doctor, ladies, I would now like to introduce you to Dr. Samir Ahmed. He is the vascular and interventional radiologist with MIMIT Health. Dr. Ahmed, how are you today? And thank you for speaking to us about this very important subject and sharing the information to help us understand and to actually help the ladies get better. How are you today?
I'm good, Sandra. How are you? Thanks for having me on this panel.
I am very well. And we appreciate you so much because women are suffering and they need to know what their options are and how to get things taken care of. And we are just so appreciative to have you here today. Again, ladies, don't forget, if you have questions, you can always put those questions into the Q&A section and we'll be able to answer those questions at the end. So Dr. Ahmed, you ready? Let's get started.
Absolutely.
All right. So Dr. Ahmed, what are uterine fibroids and are there different types of fibroids?
Sure, Sandra. So I'll start with sharing my screen just to make this a little bit easier. Can you see this?
Yes, we can.
Okay, perfect. So before we can talk about uterine fibroids, let's start by talking about the normal uterus. So women are the center pin of our universe, and the uterus is the garden of life. That's where the child grows. So every month, the uterus basically prepares for childbirth, and in order to accommodate for the child, the uterus actually has to expand. So in order to expand, the uterus has these muscles that grow in order to accommodate an entire baby inside the uterus. And if the egg gets fertilized, the baby will grow inside the uterus. But if the egg does not get fertilized, then menstruation happens and the uterus cleans itself and clears itself out, as you can see in this picture. Now, what can happen is that these muscle fibers that have to expand in order to accommodate a child, these fibers can essentially become, I would say, either they can become disfigured, or you can say that there's some abnormal growths that can occur within the fibers. And these abnormal growths are called uterine fibroids. These are non-cancerous growths, or you can say quote unquote tumors, but they're not cancer. They're essentially these balls of tissue that grow inside the muscle fibers of the uterus. And they look like these essentially balls of soft tissue. This is a pathological example of or pathology example where these fibroids have been cut out, and you can see that they essentially look like misshapen balls that have grown inside the uterus. And they tend to grow within the muscle, like I said, but they can grow also in different locations within the uterus. So some can be right in the meat of the uterus, which are intramural fibroids. Some can grow within the endometrial cavity. So this is the cavity where a child would be if a baby was inside the uterus. Some can have some outgrowth. They can grow a little bit protruding out of the uterine wall, and some can be somewhere in the middle. And it's also important to note that these uterine fibroids are very vascular structures. So a lot of the symptoms that women feel with fibroids, they occur because of not only their size, but also their vascularity. Here, this again, this is kind of reiterates what we saw in the other slide. Again, these are benign tumors, meaning that they're not cancer, but they're just growths within the uterus. They can distort the uterus because of their size. They can be single or multiple, and they occur in different locations within the uterus. And again, this is a little bit of a larger picture showing you what the fibroid looks like.